Hi, good morning Russell. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 27th of January 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Russell Thames.
Alright Russell, could you please confirm your candidate number?
Yes. My candidate number is 432334238.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you establish a rapport with a new patient?
Building a rapport with a new patient begins with a warm greeting, active listening, and demonstrating empathy. Engaging in small talk about their interests or concerns can also help create a comfortable atmosphere.
What strategies do you employ to effectively communicate with patients from diverse cultural backgrounds?
Effective communication with culturally diverse patients involves respecting and understanding their cultural norms. Asking open-ended questions, using plain language, and utilizing interpreter services when necessary contribute to clear and respectful communication.
How do you handle a situation where a patient is anxious or stressed about their medical condition?
Addressing an anxious or stressed patient involves acknowledging their feelings, offering reassurance, and providing clear and honest information about their condition and the planned interventions. Additionally, actively involving them in decision-making can help alleviate anxiety.
Describe a time when you had to collaborate with other healthcare professionals for a patient's care. How did you approach it?
Collaborating with other healthcare professionals requires effective teamwork. I ensure open communication, share relevant patient information, and actively participate in interdisciplinary meetings to coordinate and plan comprehensive care for the patient.
How do you stay updated on the latest developments and best practices in nursing?
Staying informed in nursing involves continuous learning. I regularly attend professional development seminars, participate in workshops, read nursing journals, and engage in online forums. Networking with colleagues and being a part of professional organizations also contribute to staying abreast of the latest advancements in nursing.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Good afternoon. My name is Russell Thames, one of the nurses here in the facility. How can I help you today?
Hi, Nurse Thames. My father, who is 72 years old, was told by his GP that he should get a shingles vaccination. I'm here to inquire about it and understand more about the process.
Certainly, we can discuss everything. How may I address you?
Thank you, and you can call me Mihiraa.
Mihiraa, I appreciate you coming in, and it's great that you're taking an interest in your father's health. First of all, let's talk about the shingles vaccine. It helps prevent shingles, a painful rash caused by the reactivation of the chickenpox virus. The shingles vaccine is indeed important for his age group. The vaccine is recommended for individuals aged 50 and older, especially those who have had chickenpox, as the risk of complications increases with age.
Oh, I see. That makes sense. Can you tell me more about the benefits of the vaccine?
Yes, Mihiraa. Next, I would like to explain to you the benefits of taking shingles vaccination. The shingles vaccine not only reduces the risk of developing shingles, but also lessens the severity of the illness, if it occurs. It can also help prevent complications such as post-herpetic neuralgia, which is a painful condition that can occur after a shingles episode.
That sounds important.
Yes, it is. But before we proceed, may I have your father's name and some basic details?
Sure, his name is Harmon, and he is taking medication for high blood pressure, but I'll provide you with the details. Anything else you need to know?
Yes, Mihiraa, it's crucial for us to know about any medications he's currently taking, ongoing treatments, and any allergies he may have. This information helps us ensure the safety of the vaccination process.
All right. Well, he is not under any treatments right now, but he is allergic to nuts and seafood. And how about any contraindications?
Mihiraa, given your father's allergies to nuts and seafood, it's crucial to inform you that the shingles vaccine doesn't contain any allergens related to nuts or seafood. So, there shouldn't be a problem on that front. However, we'll make sure to take all his allergies into consideration.
That's good to know. Are there any side effects of the vaccine that we should be aware of?
Like any vaccine, there can be side effects, though they are usually mild and temporary. Mihiraa, common side effects include redness and soreness at the injection site, headache, fatigue, or may experience mild flu-like symptoms. However, severe reactions are extremely rare.
Thanks for letting me know. So, is there anything specific we should do after the vaccination?
Absolutely, Mihiraa. After the vaccination, it's essential to monitor for any adverse reactions, and if necessary, report them. Also, after the vaccination, it's important for your father to come back for a review. This allows us to monitor for any adverse reactions, and ensure he receives the necessary follow-up care. Mihiraa, the follow-up appointment is highly recommended to discuss how your father is doing post-vaccination, and to address any concerns or questions that may arise.
Thank you, Nurse Russell. That's reassuring. I'll make sure my father gets the vaccine, and we'll follow up as advised.
You're welcome, Mihiraa. Before concluding, let me summarize what we have discussed so far. Your dad, Harmon, who's 72, was advised by his doctor to get a shingles vaccine. Basically, this vaccine is crucial for folks 50 and older, especially if they've had chickenpox. It helps stop the painful rash that comes from the chickenpox virus acting up again. The perks of the shingles shot include lowering the chances of getting shingles, making the illness less severe, and avoiding complications like post-herpetic neuralgia. It's good to know that, considering Harmon's high blood pressure and allergies to nuts and seafood, the vaccine is safe for him. Now, when it comes to possible side effects, there might be some redness, soreness, where they give the shot, a headache, tiredness, or feeling a bit like having the flu, but serious reactions are super rare. Lastly, it's crucial to schedule a follow-up appointment, as suggested, to check for any issues and address any concerns after the vaccination. Mihiraa, if you've got more questions or worries, just let me know.
No, nurse, that's all.
If you have any more questions, or if there's anything else you need, feel free to ask. Mihiraa, we're here to help.
Thank you again. That is the end of your OET-speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.